Hola, hola, y bienvenidos a Tu Salud, the definitive podcast for Latine and Indigenous health policy, where we talk about all things Latine, policy, and our health. I am Dr. Seciah Aquino, Executive Director at the Latino Coalition for a Healthy California. And today, I am joined by the amazing and poderosa Bamby Salcedo, CEO and President at TransLatin Coalition. Today, we'll be talking about the power of our stories in centering our fight for justice, the structural changes needed for health reform, and the organizational policies we can implement to advance health equity within our teams. Y con eso, let's get started. Hola, muy buenos días y bienvenida a Tu Salud, Bamby. We're so excited to have you today.
Thank you so much for the opportunity to be here, Seciah, and thank you so much to all the beautiful people who are watching today. Thank you.
Thank you. Well, to get us started today, let's talk about the personal. Tell us a little bit more about you, who you are.
Well, my name is Bamby Salcedo, and I am a very privileged trans Latina mujer, emigrante, indocumentada, who has the privilege to lead now the biggest translate organization in the United States. And obviously, it has not been easy to come to be the person that I am today. I come from humble beginnings. I was born and raised in Guadalajara, Mexico, by two young people who came from the outskirts of the city, who met at the city at a very young age, and my mother and my father, gave born to three beautiful and amazing children. Uh, but my father left my mother before I was born. And so my mother was left to raise us with, with however she was able to. And because she needed to work and do all of that, I didn't have the support and the love and everything that I needed at the time. My mother soon after got together with a very abusive person, and my outlet was to start using drugs at a very early age. So I started sniffing glue about 8 years old. I started being institutionalized at age 12, and youth facilities in Mexico until I had the opportunity to meet my father, who was living in the United States at that time, and went to Mexico, to Guadalajara. And when I was 15, I was incarcerated at the youth facility, and I was able to um, I was able to meet him, and he offered for me to come when I get out, and I did that. At 16, I came to the United States. Came to the United States and started using heavier drugs here, until I finally came to LA at 18, and that's when I started my transition, and I started, being involved in the street economy because that's what I knew. And that took me to go to prison 4 different times, being deported 4 different times, um, until I finally reformed my life and started working in social justice. And so here I am now. After many trials and tribulations, I got to become the person that I am today because of the support of many people like you and others, many members of our community.
Thank you so much for sharing. I feel so privileged to be not just in the work with you, but to know you. And I think everyone knows this, but any room that you walk into, you bring that light, you bring the joy, and just make all of us smile with just your shine and your brightness. So I just want to say thank you for that as well.
Oh, thank you, Hermosa. it really means a lot. I'm just grateful that I get to live today and that I get to live every day, and I try to live the best possible way that I can, and obviously share that with everyone who I come across with.
Mm, I love that. So, going into your experience getting into the social justice space and the nonprofit space, tell us a little bit about that journey. How did that take you into your role today?
Uh, well, I started being involved in community uh, around 1997, 1998.
Mm-hmm.
Back then, there was um, an organization that is called Bienestar,
Mm-hmm.
who
Yeah.
some people may be familiar with. They started a support group for trans Latinas. And at that time, I was still, using drugs, and I was involved in and whatever I was doing at that time. But I started organizing my friends, right? Like,
Mm,
let's go to this group and let's go, let's bring our voices, and let's talk about our needs and issues, right? And so I started then, and also, the police was very harsh towards us, right? Because
mm,
they obviously, we have always been criminalized because of who we are, but um, they were using entrapments to put us in
mm,
jail, and vice operations and all of those things, right? And so we protested
mm,
LAPD and the Hollywood station, um, and so then it took me another prison term,
mm,
and then when I got out in 2000, um, I was deported and then came back, and that's when you know, I guess my life circumstances sort of like pushed me to
mm,
ask my higher power, God, to help me, and um, I somehow ended up in a rehab,
mm,
um, and that's how sort of like my journey started. And then when I was in rehab, I think, there were a couple of things that happened. One, they didn't have any services, uh, yeah, support for people who were monolingual Spanish speakers,
mhm,
right? And so there were a couple of people who didn't speak any English, and
mhm.
so they were there, but they were there, because they were taking their money, their insurance, or
Right,
whatever it was, right? But they were not getting anything,
right.
any type of support, and so I started advocating, about that. And then as I was going in the progression of my treatment
Mhm,
there, there were different things that you needed to do in order to like go to the different phases.
mhm,
And so I asked my counselor to help me find a way for me to learn how to facilitate groups.
mm.
And and so I was trained to facilitate, and so I started a Spanish speaking group there.
Ah.
And also, I was the only trans person there, and so there was really nothing specifically for LGBTQ people.
Mm,
So I was doing that too. So I had two groups that I was facilitating, one for Spanish speakers, and the other one for LGBTQ people.
mm.
Um,
Amazing.
and then when I was in this treatment facility, as you're getting ready to graduate, you're supposed to, get a job or do something, right, with your
Mhm,
life.
mhm.
But because I was undocumented, I couldn't get a job,
Right.
and also because I'm trans, right, it was harder, and the
Mm,
expectations, are for everybody the same, right, and
yeah.
so my experience was different then, in that regard. And so what I did was that I enrolled myself in an adult school,
Mhm,
to learn computers or to learn how to type, because then It was in 2000, and I couldn't even. Um, I didn't even know how to turn on a computer, and so that was, what I needed to do in order for me to get out of this treatment facility. And I went to a transitional housing program. And when I was in this transitional housing program, there was a position open at Bienestar
Mm-hmm.
to do outreach. Um, it was an HIV prevention um, position, and
Mm-hmm.
also to facilitate groups to for other trans, Latinas. And so I applied and I got the job, and that was sort of like my introduction
Mm-hmm.
to all of this. But I do have to say that in 2002, Gwen Araujo was murdered.
Mm-hmm.
Gwen Araujo was a young trans girl who was barely beaten and buried alive, and
My God.
um, that personally touched me and really enraged me. And I got to the point to say, like, oh hell no, right? And
Mm-hmm.
because I was able to see things differently, right? I wasn't under the influence of any substances, and I was seeing that my experiences, my friends were still experiencing them,
Mm-hmm.
and that, and so because I had this privilege of having a job and all of this, I also felt that I had a responsibility, right?
Mm-hmm.
And so that's how I started sort of like organizing more radically, I guess, because again, the murder of Wenarajo really touched me, and but also I think change um, the broader trans movement as well.
Yeah. Oh, that's
So that
beautiful.
was a pivotal moment for me.
That's beautiful. Thank you for sharing it. And this movement into representing the community, right? With your story, with your voice, bringing and centering the trans community, trans Latina community in this work. Can you share a little bit more about, what that looks like in the work and in your personal life?
Yeah. So I mean, obviously, since I started working, I started back then. It's like I've been working on nonprofit work or nonprofit organizations, right, for a while. And so I started like as an entry level position, and then from there I became a manager. I became, um, different programs. Then I went to work for Children's Hospital Los Angeles,
Mm-hmm.
um, and so I've learned, program design. I learned
Mm-hmm.
evaluation, right? Like I learned different things. Not only that, but I also started going to school. So I went to the only education that I had at the time was sixth grade. I went to school in Mexico.
Mm-hmm.
So I only finished primary school, right, or la primaria, and that was it, right. And then when I was here and I was like learning all of these things, and specifically when I was at Children's Hospital Los Angeles, I remember that I was a project coordinator, but I didn't have um, these letters after my name, right, and
Mm-hmm.
so I couldn't get promotions, right. I saw that there was other people who were like program managers who had
Mm-hmm.
like master degree level education, and only had like two people that they were managing, and they were making more money. And I was a project coordinator, and I had like 10 people that I was managing,
Right.
and I was making less money than they were, and that's how that system worked, right. And so I
Mm-hmm.
was like, oh, I need to get in school. And so I went and enrolled in the community college. I did an assessment test, and I started, my educational journey. And I I was stuck in community college for about 10 years because my math level was very low, and so in order for me to transfer, I needed to
Mm.
know statistics. Nonetheless, I took statistics 3 times and I passed
Love it.
finally. I transfer and then was able to get a master's degree after all.
Mm.
Um, but all of that to say is that my personal experience, my work experience, but also you know through that process, my academic experience as well, right?
Mhm, mhm,
In 2009, I am a survivor also of the immigration detention. I was beaten when I was in
mm,
immigration detention, and I was transported out of the immigration detention to a
mm,
hospital to be cared for. And so back then, the conditions of trans women in immigration detention were horrible, right? Like there were
mhm.
cases of people who, were sexually abused and beaten and all of that, and nobody would do anything.
No.
And so, I lived that. I felt, I seen that, and I so I got some of my friends together and
Mm,
say like, what are we gonna do, right? We need to have a voice. We need to have, we need to uplift our needs and issues.
yeah.
And at that time, there were two translate organizations that were doing obviously amazing work, but we're not thinking of the needs of
Mm,
trans Latino people, and so we started, um, going to visit our friends at the detention centers, get them connected to lawyers, fundraise to put money in their books, and
mhm,
picking them up when they would get out, and you know, give them social or connect them to social service organizations, and we did all of this on a volunteer basis for six
right.
years,
Wow.
until we finally got our first grant in
Mm,
January 2016, and then we built our organization.
mm.
I was doing my master's program at that time, while at the same time I was building an organization, and so
Wow.
it was. It has been challenging, obviously, but it has also been beautiful,
Yeah.
to build specific services designed to uplift the livelihood of our community, right? And we have evolved into not just um, support trans Latino people, right? But
Mhm.
also to think of the infrastructure development that needs to happen in our community
Right.
and how we contribute to that, right? And so we do direct service provision to our community, but also we do policy work, right? And
Yes.
so we function with these two arms
Yeah.
to better the livelihood of our community.
That's so powerful. That's so powerful. And I'm so glad that you all handle this balance, right? Of the addressing the acute needs, but also thinking long term, how do we create this policy change, this structural change to make sure that this work is sustainable across time and beyond any of us?
For sure. And I mean, obviously, health is one of the things that it's important to us, right? Because
Mm-hmm.
the way we're thinking about this is like, how do we build healthy trans people, right?
Yes.
Um, and I'm so grateful that we are working together in
Mm-hmm.
this, health reform campaign, in which, we are part of, but we are bringing the voices of transgender, non-conforming, and intersex people into this whole, you know, thing, right?
Yeah.
So I'm really excited and grateful that
I
we get to do this.
I couldn't agree more. And in that search for health equity, what do you think is left to do? How do we finally achieve health equity for our communities?
I mean, there's a lot of work that needs to happen, obviously, right?
Mm-hmm.
I think there's a lot of education that
Mm.
needs to happen. Uh, but there is, a systemic change that needs to happen,
Yeah.
right? I think it's important to understand that how the healthcare system is designed, it
Mm-hmm.
really is to make money off people, right?
Mm-hmm.
That is why, you know, they have built this narrative of, insurances, right?
Mm-hmm.
And, you know, if you have better insurance, then you have better access to care, right? And so many of our peoples don't necessarily have that type of care, right?
Mm-hmm.
Most of our peoples rely on the, I guess for the lack of a better word, like government care, right?
Mm-hmm.
And so
Mm-hmm.
because there's so many people, the system is so saturated, and ultimately people don't get the care that they deserve.
Yeah.
And that is again because if you have the resources and the best insurance, or
Right.
if you're able to pay for a private doctor or private
Mm-hmm.
hospital, then you can get better care. And so
Yeah.
we need to obviously influence that change, right? Because
Right.
healthcare is a human right, and
Yeah.
um, you know everyone should have access to the care that they need when they need it,
Mm-hmm.
regardless of uh, monetary status or social status, right? And
Mm-hmm.
so I think broadly we have to think about how we are going to transform the system as is,
Mm-hmm.
uh, and make it work for for all, and not just for a few that do
Yeah.
have the ability to have access.
Beautifully put. And many times in our day to day work, we're talking about these big changes. And sometimes we forget that we have the power to influence and make a huge difference in the lives of those around us. I know you all work very intentionally to make sure you're centering health equity with your team. And I've heard about the amazing opportunities that you provide for your team, from a sabbatical to massages. Can you tell us about those health equity practices within your team?
Well, I mean, yes, we as an organization, are intentional in understanding, right,
Mm,
of um, how hard this work is, right?
yeah.
Um, but also, what we need to do to take care of the people who do this work,
Yeah.
right? And so we have implemented different policies here at our organization to really take care of people, right? Like every first Monday of the month, people, they're a self-care day or a mental health day, or
Mm,
however people want to frame it. But basically, they just get a day off that is paid to
wow.
do whatever they want. Some people, may need to do their laundry or
Yeah.
whatever it is, right?
Yeah.
Because a lot of times we don't, sometimes people want to do their nails, whatever it is, right?
Mm-hmm.
So that's some of the things that we do. We we have implemented a sabbatical policy for all of our employees.
Wow.
We also this year we started a policy to support our employees, those who want to get into higher education.
That's
We
great.
will cover 50% of their tuition. Obviously, not necessarily private schools, yes, but we will support them with some. Obviously, we know that some private schools are super expensive,
Yeah. Yeah.
and so we have to have some type of limitation for that. But
Yeah.
if they would go to like a UC or Cal State system, for instance, we will cover 50% of their tuition.
That's
Um,
huge.
yeah, I mean, I remember when I was in Children's Hospital Los Angeles, like I used to pay $6,000 for my tuition every quarter.
Uh-huh.
Uh, no, no, wait, semester. It was a semester because every quarter was 3,000.
Mm.
And I would only get like 200 bucks. They did have a
Right.
tuition program, but you know, which, is something, but we want to be intentional
Of
in
course.
how we are supporting people, right? And so, so those are some of the things that we have incorporated. In addition to that, all of our employees also get free healthcare. Um, so any copays or whatever they have to pay for, we reimburse them. And that includes obviously a good dental plan.
Mm-hmm.
Oral health is also important. Um, and vision. And for life insurance, we are providing a we have created a fund here internally to
Mm-hmm.
support our employees
Yeah.
who may need it to to cover some of the expenses that they if they need to for if something tragic happens, right?
Right. Right.
And so those are some of the things that we are
Yeah.
doing to support our community
I love that.
here, our employees.
Yeah, I love how intentional you are in creating a healthy work environment, an environment where your team feels supported. I think that's so important in the nonprofit space because a lot of the folks that we get in our offices have very much personally experienced the work that now we're trying to address. So we have to take care of each other in this work.
Yes, and we definitely try to find ways. My job is to fundraise, so that that's what I need to do. Like have multiple conversations with people to understand what needs to happen to support our people as a whole.
I love that. I love that. Well, con eso, muchísimas gracias for joining us today. It was such a beautiful conversation, and I feel so privileged to be spending this morning with you and having this beautiful conversation with you.
No, thank you so much for the opportunity to chat with you and to share space with you, and obviously to the audience. Please be well, be healthy, take care, and be your best always.
I love it. Muchísimas gracias.
Un abrazote, bella. Que estés
Un
bien.
abrazote.
Te quiero.
Bye bye.
Bye bye.